Hi there, my name is Dr. Sinan Mir. I'm a GP and longevity doctor. Today, I want to briefly run through the commonest way to figure out whether you have an issue with how much alcohol that you drink. What I'd like to go through is a common questionnaire that we use in primary care, commonly used by doctors in the UK, to briefly and quickly assess whether someone is having too much alcohol or is an at-risk drinker. Problematic alcohol use in the UK is when someone exceeds the low-risk drinking guideline. In the UK, that means for men and women, you shouldn't consume more than 14 units of alcohol per week. And if you do consume around about 14 units, they should be spread across at least 3 days over the week. 1 unit of alcohol is defined as about 10 mils or 8 grams of ethanol. That's equivalent to about a small glass of wine or half a pint, higher strength beer, or a small measure of spirits. At least in the UK and in many countries all over the world, is a major public health problem. Alcohol causes innumerable problems. It's one of the commonest reasons people attend the emergency department, partly because they fall, partly because they injure themselves, partly because they injure other people, partly because of accidents related to transportation. And alcohol, of course, is a major source of physical disease. There are loads of diseases that are either directly caused by alcohol or associated with alcohol. Yeah, approximately 20 or 30 diseases directly caused and maybe 60 or 70 that are associated with alcohol. Many of those are life-threatening. Many of them are not reversible. So picking up problematic alcohol drinking early on is important from a physical health perspective at the individual level, but also the ramifications from a population health level are huge. Problem here, though, is that alcohol, depending on your culture, can be very normalized. I'm based in the UK. Alcohol is quite a common part of the culture. Alcohol drinking early on, before the age of 18, is relatively common. What I find in clinic very, very regularly is when I tell patients or talk to patients about what a healthy level of alcohol intake is, which even that is debatable. Some people do argue that 0 amounts of alcohol is the healthiest amount of alcohol, but the government recommendations, you shouldn't exceed 14 units of alcohol. When I say this to a lot of my patients, they often cannot believe that people drink that little. There's definitely a subsection in the population that do drink way more than these 14 units per week. But one thing that is encouraging, and certainly that I've noticed over the last 10, 20 years of practicing medicine, is that the culture itself is certainly shifting in a direction where the majority of people are drinking less and less alcohol in totality. Many people are not drinking any alcohol at all for health reasons. So that is an actual really encouraging change. Part of the reason for that is increased awareness of the health risks associated with alcohol, as well as just the general cost of alcohol. But alcohol, of course, has negative effects in the short and long term as well. People don't feel great after drinking a large amount of alcohol the next day usually, and often even when they're drinking, they don't feel particularly great either. So the main tool, one of the main jobs that we have when we have a new patient or when we have a patient where we're concerned about alcohol, is to do a screening questionnaire. We like to ask a few quick questions that give us an idea to understand whether this patient is a problematic or at-risk drinker. To do this, we use a validated questionnaire. There's loads and loads of different types of questionnaires. One of the commonest ones that's used in the UK in primary care is something called the Audit-C. There's a few different types of audit tests. Audit stands for Alcohol Use Disorder Identification Test. There's a original audit test, which is much longer. It's got like 10, 12 questions from memory. And then there is a short version, which is the Audit-C, which only has a couple of questions and is used as a much more speedy, quick screen to check if someone needs further questioning and potentially further intervention. So it's this test that I'm going to walk you through now. Feel free to answer the questions for yourself. Again, this is a questionnaire that would normally be asked by a healthcare professional to you. It's not been validated for you to use it for yourself and by yourself, but for the best part, it will certainly give you an idea of whether you're on the threshold of what would be considered to be an at-risk drinker or whether you're below that threshold. It doesn't tell you much more than that. In the context of a wider clinical history, in the context of who you are, what your living situation is, what your other medical conditions are, where you are in your life, this is useful, and it gives us an idea about whether we need to consider more interventions, medications to help from an alcohol perspective, or referral to drug and alcohol dependency services. So again, always these questionnaires are done in a context of you and your life, and they're done by a healthcare professional that's used to asking these questions. With that caveat in mind, let's walk through the questions. So let's walk through the questionnaire. So once we walk through these questions, there's only 3 of them in this short Audit-C screen. You'll come out with a number or come out with a score. Depending on the score, if it's over a threshold for male and female, that suggests that alcohol misuse is a risk factor here, and that needs to be managed. So let's walk through the questions. How often did you have a drink containing alcohol in the past year? I've put here 2 to to 3 times per week. How many drinks containing alcohol did you have on a typical day when you were drinking in the past year? So how many drinks per day when I do drink? Let's say 3 or 4. And then how often did you have 6 or more drinks on one occasion in the past year? So this is a question hinting at evidence of binge drinking. So let's say monthly, once a month, I had more than 6 drinks on one occasion. And that's it. Those 3 questions, that's all it takes. Literally takes 30 seconds. And it gives you a point score here. This is 6 points. So it's already saying here that over 5 is consistent with alcohol misuse and possible liver damage. As a general rule, for females, if you've got 3 or above, that's a risk for alcohol misuse. For males, 4 or above is a risk for alcohol misuse as well. So that suggests something else needs to be done. That something else may be flicking over from the short version of the questionnaire to the longer version, the audit questionnaire, which has got, I think, 10 questions or so. Give us a little bit more granularity as to the degree of alcohol misuse before we decide on next steps. One of the next steps is likely to be referring to a service that specializes in drug misuse, drug and alcohol misuse. So in the UK, we have access to those services. Often patients and people can refer themselves to the service. They don't need to go through a doctor or another healthcare professional to access those services, but they are excellent services that help patients in again, a global context of their life, the best way, providing the best resources to help someone manage and curb alcohol intake and have more control over their alcohol use. As I mentioned at the top of this, there are other questionnaires that give an idea about alcohol use. This one's focusing on people that are at risk of alcohol misuse. There's another famous common questionnaire called the CAGE questionnaire. That's 4 questions. That's more looking at whether someone has a kind of alcohol dependency, someone that's likely to have been using alcohol for a long period of time and now to have got hooked or dependent on alcohol use. So that's a slightly different questionnaire, answers a different question, but also a very common question that we use for people that have been using alcohol for many years and finding it difficult to stop. But this one that we just walked through is a really common one. You can look at it yourself and see where you fit on those parameters. Just to give you an idea, a very simple screening level. If you're concerned or if you want additional help, do reach out to your healthcare professional to discuss further and or consider looking into any alcohol services that are local to you. Once again, many thanks for watching. Hit that subscribe button. Until next time, stay healthy.